Hello, everyone. I'm back. This time is for a video of anticoagulant therapy. If you're looking for my video on deep vein thrombosis or peripheral venous disorders, um, I have a different video for that. This time is just going to be talking about an anticoagulant therapy video, okay? So let's get started. So pretty much, an anticoagulant therapy is used not just for DVTs or a clot, so to speak. Sometimes it's prophylactically that we're trying to avoid a clot. But in general, here are the main classes that we discuss. First is your heparin sodium. It could be given sub-Q or IV. It basically inhibits thrombin-mediated conversion of the fibrinogen to fibrin by affecting your coagulation factors. Now, with this drug, we do frequent monitoring of APTT, and you're going to know that in your book, they talk about the normal levels and the therapeutic levels. So when someone is in an anticoagulant therapy, you want them in a therapeutic level. So you want to make sure that they're between 46 to 70 seconds. Now, it does have some complications and it could cause heparin-induced thrombocytopenia, which is low platelets, and osteoporosis. The antidote is protamine sulfate. Now, your second class is low molecular weight heparin. It does the same thing. It affects with coagulation factor, but it's likely a little less likely to cause complications, such as the heparin-induced thrombocytopenia or osteoporosis. There's less monitoring that goes on with it, although in the hospital, sometimes we do monitor your APT-T and your INR. And it neutralizes, the drug that neutralizes is the same thing, the protamine sulfate. Now, the next classification is your vitamin K antagonist. This is your warfarin. It's given PO only. It inhibits the activation of vitamin K dependent coagulation factors, your 2, your 7, your 9, and your 10. It does require lots and kind of almost daily INR checks to get to a therapeutic level of 2 to 3. It needs to be given every day, and it does take up to 3 days to reach that level, that therapeutic level. So sometimes we bridge it with other medications such as heparin. The antidote is vitamin K or fresh frozen plasma. And there's some education that goes on when someone is on heparin that I'm soon going to be talking about. And one of it is your vitamin K low diet. The next classification is factor XA inhibitors. They finish on XA band. So apixaban, rivaroxaban, and these are PO except for Arextra, that it's a sub-Q injection. They inhibit factor XA and they're pretty good in anticoagulation, but it doesn't require that much monitoring. Now, a lot of doctors are switching to this because of the less need for monitoring. However, they can cause severe bleeding. You can monitor the activity with an anti-XA assay. So let's talk about warfarin and the education. Education is key. We need to make sure that they are in a low vitamin K diet, and low vitamin K includes all your green leafy vegetables, liver, as a meat. You have some other vegetables that are not green, but your main ones are going to be your green ones. Not only is just your foods, but also herbal products. They increase the bleeding risk for the patients while taking warfarin. such as garlic, ginger, ginkgo, and ginseng. You also want to educate them to try to avoid any activities that can cause bleeding or harm. Basically, they are a high risk for um, perhaps an injury. And so you any kind of contact sport, any racers like cutting accidentally, monitor for excess bleeding in the urine, rectal, vomiting, coffee grounds, nosebleeds, etc. Here's another list of high to moderate and low. And now keep in mind, it's not that they can never eat any of this. It's that you want to consider the amount and the frequency. So for example, if a patient comes and says, all right, well, can I have, let's say, a celery stick once a month when I'm eating my hot wings, let's say, they give you celery sticks. Well, sure, you can have one, once a month. It's okay, but you don't want to have these every day in an abundant amount. So some nursing considerations, again, education, there are fall risks. If you are removing an IV or getting an injury, you want to hold pressure for 15, 30 seconds. You want to avoid any intramuscular injections as much possible. You want to monitor for bleeding in all the orifice that we have. Also checking on skin for bruises, hematoma. Limit alcohol. Try not to combine them with other anticoagulants or antiplatelets, although I've seen it where, if they're bridging to get that therapeutic level, or if, let's say, we have a bad, severe cardiac patient that is at high risk for clots, they might give them a little baby aspirin, 81 milligrams, and then an anticoagulant. IV heparin drip is titrated and also verified by 2 nurses. Please make sure you review in your book your therapeutic level versus your normal, because that's something you have to memorize for the rest of your career. Now, there is something that I want to make sure that you guys know. It is the difference between thrombolytics, antiplatelets, and anticoagulants. Especially in this unit exam, we cover antiplatelets and anticoagulants. Now, let's review. Antiplatelets are medications that inhibit your platelets from sticking to each other and then developing this little mountain of platelets, which can cause a clot. Anticoagulants deal with the synthesis or inhibiting the production of these clotting factors that we have. So they're not the same. They sort of work in the same objective, which is preventing blood clots, but they're not the same. Thrombolytics, on the other hand, are drugs that dissolve a clot. So anticoagulants and antiplatelets do not dissolve clots, they just prevent them, but thrombolytics do. Let's see, what else? Now we'll talk about thrombolytics and stroke a little later, but for right now, just make sure that you know those differences. I hope this was helpful, and I will see you in the next video. Put in my reference here that I referenced the book, any images from Google or the book, or the individuals who created that I cited them here. See you in the next video. Bye-bye.